I am from Sacramento, California. I was born and raised. First thing I'm going to do in Chicago is go to the pizza place and get a deep dish pizza. Can I redo this one? Oh, okay. I'm excited, I'm nervous, I'm anxious, I want to do really well. So actually ready to get back into school.
Recently, first-year medical student Joe Santamaria had a one-on-one conversation with Rush University President Dr. Larry Goodman.
Oh, yes. So I was writing down my list of questions, and I realized that a lot of them sounded sort of like med school interview questions, so I promise this isn't payback or anything like that.
I was just wondering. I hope I get in.
Yeah. I was hoping to ask you a couple questions today, I guess more so on behalf of the first-year medical class, just to get a little perspective from someone that's been through the process before, if you don't mind.
Great.
My first question to you is, what were some of the things that got you through medical school when you were going through the process, starting from first year?
I think medical school is hard, and I think you're right. It's hard to keep it in perspective as far as you're going to be taking care of patients someday, and yet the first year or even 2 years of medical school, you don't do that much of that. I mean, obviously we try to get you in touch with patients as quickly as possible. You've had some clinical experiences, but most of what you're doing still comes back to it's kind of you versus the books. And what was pleasantly surprising for me was that almost all of the things that I covered in those first few years of medical school and the things you're covering now will be relevant to clinical medicine. It's really important. I know that students feel so responsible of learning everything they can possibly learn and feeling badly if they don't learn it well. You're going to get it again and again. And I think the last thing is your relationships with the other students. You know, it's fun to be talking about these things. You're all got the same kind of goal, and you're going to do great, and you're all going to get there.
Did you always know that you wanted to be a physician? And then to follow up on that, did you expect to ever take an administrative role and sort of change fields a little bit as you went along?
So that's pretty much no, no, and no. So I was an English major. There was nobody in my family who was a doctor. I did think it might be interesting to go to medical school. Did apply, was fortunate enough to get into medical school. Absolutely loved it. Never would have thought I would be doing anything other than practicing my entire career. Absolutely loved taking care of patients. I love to teach. I enjoy doing research. And for me, as it turned out though, from my first job at Rush after my residency and fellowship training, I did have an administrative job in the dean's office as assistant and associate dean. Then I worked at Cook County as medical director, came back as dean of the medical school, and now CEO. This is the first job I really can't make clinical rounds, and I miss that part, but I really greatly enjoy what I'm doing now.
Can you recall any stories that you have either from medical school or residency that really made you take a step back and say, this is why I'm doing this, and this is what I'm meant to do?
I had a patient when I was an intern who was one of my first patients who got very, very sick, and she was a young woman who was 17 and had lupus, and then later that night she dropped her blood pressure, and it turns out she started to bleed, and it looked like she might have been bleeding either into the pleural space or maybe I had punctured her spleen. So in other words, maybe I was contributing to what was going on with this young woman and she might not survive. Then it turned out I hadn't punctured her spleen. But it did leave me with this feeling that of kind of a couple of things. It was amazing how much the sense of like worry you can have about causing harm to a patient, and this huge hope I would have that people can. I used to say, you know, I hope I can save a few people before I harm somebody, because you realize this isn't, you know, as much as it's like all other kinds of school, it's absolutely for real. I mean, all this stuff counts, and it wasn't like I put the needle in wrong or incorrectly. Nevertheless, this could have been a life-threatening complication, and that left a huge impression on me. It really did.
The conversation with Dr. Goodman and Joe Santamaria continues in Chapter 6.